Hi, good morning, everyone. As folks are trickling in, I want to welcome you to our department grand rounds. My name is Dr. Eric Hung, and it is my pleasure this morning to be able to introduce and also to moderate our grand rounds for today. Our speaker is none other than Dr. Descartes Li. Descartes needs probably no introduction in our department since he's been at UCSF as a UCSF lifer across many lives and many years. And his wisdom is gonna, I think, really pay off in dividends to us today with the topic that he's gonna be presenting. For those that may not know Descartes, Descartes is a professor of psychiatry at the University of California at San Francisco, our university. And he is currently serving as the vice chair of education for our department. And apropos to this presentation, he recently co-chaired a professionalism action group for the UCSF Academy of Medical Educators. This session and workshop has been presented in many different areas and arenas across UCSF, and we're really fortunate and lucky to have him present with us today. Dr. Li also serves as the director of both the UCSF Electroconvulsive Therapy Service, our ECT service, as well as the UCSF Bipolar Disorders Program. And I will say on a kind of personal note that Descartes has just been a champion for medical education, whether it's medical students, psychology trainees, psychiatry residents, psychiatry fellows, research fellows. Descartes has been behind the scenes doing a lot of the heavy lifting to make our education community a strong one. And for those that doubt that, he even went so far as to get a morale grant during the pandemic for our community of medical educators to be able to host a series of movie nights, which over the course of this year with all of the strains that we've all been going through, it's been one of those small moments of sort of joy that Descartes has been spearheading. So without further ado, I'd like to introduce to the Zoom stage Dr. Descartes Li.
Well, thank you so much, Eric. It's a very kind introduction. I've known Eric for a really long time, and I'll say a little bit more about Eric later in this talk on professionalism, but that was a super kind introduction. And Eric, although I was his supervisor, he really is a role model for teachers and professionalism, and I'll say a little bit more about why that is in just a moment. So. This talk I'm going to call Professionalism Update 2021, New Concepts in Professionalism. I realize people might still be trickling in, and so I'll just go ahead, and I have little break parts in the talk so people can see it, and I may be a little bit repetitious, so it's okay if people are a little bit late. I don't have any disclosures. I wanted to acknowledge some other people who are not in our department. Catherine Lucy and Ponsalet, Ezgi Taraki, Ariana Tarani, and the Professionalism Action Group, and all the names are there. Professional Action Group is an action group that was called by Anne Ponsalet to push the envelope forward in terms of professionalism within the Academy of Medical Educators. And I'm going to talk a little bit about my experiences with that and what I learned and share with you all. That's kind of my goal. And so this is the...
For 1 second, I think your slides aren't showing yet.
My what?
Your slides.
Oh, my slides are not showing. Okay, thank you. Here we go. Is that showing now? Okay, so I'll do a quick recap. Professionalism update, no disclosures, acknowledgement and thanks. Catherine Lucy, Ann Ponsalet, Ezgi Taraki, Ariane Tarani, and the Professionalism Action Group. So let me just summarize a little bit, give you a little introduction to this talk here. So first, I'm going to talk a little bit about the problem and problems of professionalism and like how it's been traditionally conceptualized as this kind of on-off thing. You're either professional or you're not. And it's primarily been thought of as a maybe kind of a traditionalist kind of mode. And so one of the topics and things I'll put forward is like thinking of professionalism as a dynamic, embedded in a context and culture kind of concept. I want to talk about professionalism as teachers. Now, we as a faculty and community and the Department of Psychiatry and Behavioral Sciences not only do we have, our ethical and professional responsibilities as clinicians and faculty members and researchers, we also have ethical responsibilities as teachers and educators. And now teachers and educators have a long history of ethical obligations, but I don't know if we've talked that much about them for those of us who kind of fit that in-between zone of both educator and clinician and researcher. The third thing I want to talk about is professionalism as a continuum. So rather than this dichotomous thing, either you're professional or you're not, there's this, you can be more or less expert or novice in terms of professionalism. And thinking of it as a set of competencies or skills that you can develop is another way to conceptualize it. And then I want to talk a little bit about professionalism as a systems issue, that it's often not just like a person is professional or not professional, but these behaviors that we all have are embedded in systems and in cultures, and how we need to think about professionalism. And if we want to make improvements or move forward professionalism, we have to think about it as a systems issue. And then finally, I want to talk a little bit about next steps for us and maybe put forward champion some positive role models of professionalism. And then I want to say also, I put these in this order for this presentation. It's a relatively arbitrary order. I could have rearranged it in any order. I guess I would have put the problem first and then the next steps last, but any of these other three could kind of go in a order. But I started with teachers first. So basically, let me just summarize real quick. I just said a lot there. We want to identify the responsibilities of educators, recognize that professionalism is on a continuum. We want to apply a systems-based perspective to professionalism, and we want to think about how we can support and move forward our culture of professionalism in our own department, I think. Okay, first, let me start with the problem and problems of professionalism. I mean, there are tons of examples out there. This is one more recently about Lawrence Nassar. The thing I wanted to highlight here is it became clear that there were multiple opportunities to stop him earlier that were missed. And so thinking about these cases come up not infrequently in our newspapers and stuff. And by the way, it doesn't happen just in the New York Times and elsewhere, but UCSF as well. But one of the concepts we have these highly publicized illegalities involving physicians. That is just the tip of the iceberg in general. Whenever these things are examined, it turns out that there's this whole stuff underneath, which represents collective tolerance of these behaviors that kind of, not quite a slippery slope, but like a massive iceberg underneath the water that we actually see of disruptive behaviors, learner mistreatment, conflicts of interest, disregard of evidence-based standard practice, safety practices or precautions, and then daily incivilities. And just to prove my point, there's been several articles written about this. Majority of nurses and physicians have witnessed unprofessional behavior. 75% of personnel have witnessed disruptive behavior which contributed to poor quality care. 25 to 50% of residents reported witnessing greater than 4 episodes of disrespect in the healthcare environment. And I think our residents actually are the insiders because they pass between all the different units in our system, and they actually see it probably in some ways better than anyone else. So when the survey of residents report this, we have to take it really seriously. And basically all medical students, same thing with them. They also see everything with these, kind of novice eyes in some ways. They report witnessing unprofessional behavior. Now, some of the factors that are kind of thought to degrade professionalism is, the tolerance of clearly incompetent physicians, resistance to evidence-based measures to prevent errors and improve care, and in some ways our tacit acceptance of escalating healthcare expenditures and healthcare disparities. All of these kind of degrade professionalism. There's been some criticism of professionalism as kind of a coded language for traditionalism and favoritism. And these, and I think I don't know about everyone, but I know I am, we're guilty of some of these cultural things that can degrade professionalism. That would include, upholding, these very traditional standards and values, always imbuing everything with a sense of urgency. I know I'm definitely guilty of that. Perfectionism, binary thinking. But what I would want to, one little thing I'm going to point out, hopefully by the end of this presentation, or maybe just mention that this definition of professionalism can be dynamic and change over time. And so we all have input into this. So there's hope for us as long as we want to exert some effort into this. Now, so I've titled this professionalism. So this talk professional. What is professionalism? And if you look it up, you don't get any great definitions. The Merriam-Webster definition defines professionalism as the conduct, aims, or qualities that characterize or mark a profession or a professional person. Okay, so well, that calls the question, what is the profession? Profession is a calling requiring specialized knowledge and often long and intensive academic preparation. So I don't think that really captures what we think of as professionalism, or it's extremely vague. And if you look further into it, this definition of professionalism is not easy to define. It's not easy to explicate or put into words. So the other question is, how do we know when someone is behaving professionally or conversely unprofessionally? I would argue that in some ways that really requires a lot of empathy on the evaluator's part. We have to put ourselves in the other person's shoes and think to ourselves, would we do that, or what kind of thing? So to really understand professionals, we actually have to understand motivation sometimes, like why did someone do that? So it's not like it doesn't matter what the behavior is, it's always good or bad. There are things that you could think about that you want to put yourself in the other person's shoes, and then that's how we decide whether someone's professional or not. And therefore, it really does depend on a culture. And I think in some ways, for example, if you're of the same profession, you're much better able to determine if the other person's behavior is professional or not professional, because you know what it's like to be in that person's shoes. Like for me, as an example, I don't fly planes or anything like that. So for an airplane pilot, it would be very hard for me to tell whether an airplane pilot's behavior is professional or unprofessional. But if someone else is a psychiatrist or a physician, I think I have a much better sense of what the life is like of a physician. And so this begins to overlap a lot with diversity and equity and inclusion issues, as well as interprofessionalism. So just to put that other hat on there. So, and by the way, if anyone has questions in the chat, I'll have a little pause with these yellow background slides every once in a while. And Eric's monitoring the chat. If you have any questions or comments, feel free to put them in. And if it's appropriate, we can chat about it a little bit. I think I'm doing okay on the time at this point. So let me talk a little bit about anything in the chat. I'll assume Eric is going to unmute and say something.
Nothing in the chat so far.
Okay. So let's talk about our ethical responsibility, our professional responsibilities as teachers. I don't know how much of you have thought about this as separate from our responsibilities as clinicians or researchers. So here's a scenario that I want to put out there, and this is going to put yourself in maybe Eric's shoes here. He's the RTP director. So we have at 2 a.m., Robin, a second-year psychiatry resident, was on overnight call. The adult psychiatry unit is full, and she is in the emergency room trying to transfer several patients in the emergency room to other hospitals while responding to the pager. She is repeatedly called by the nurse from the inpatient unit about a patient on her coverage list. This patient was signed out with explicit instructions not to increase pain meds for his chronic pain. The patient is demanding to be seen, and the nurse is demanding that the resident come to the floor. After the fourth call, the resident loudly scolds the nurse, uses harsh language in referring to the patient, and slams down the phone, all in earshot of a busy emergency room. So now imagine you are Eric Hung, and what are you going to do about this situation? And an incident report is filed, and you overhear, as the training director, some people who make comments like, well, who lets people like this into medical school? Or I hope the program director puts this person on probation. But this person should be fired immediately. And I hope we figure out a better way to equip our physicians to deal with our sometimes hostile environment. Now, we don't have a poll function here, but I want you to just imagine that you're going to vote on some of these. Which of the following do you think are the best responses? And if you want to just read through these and just maybe put something in the chat or make a comment, which of these do you think would be good, or which one would you meet with the resident to discuss this behavior? Would you write a letter of reprimand to this, put it in the file of the resident? Would you investigate this behavior to see if it's part of a pattern by the resident? Would you review the sign-out system? Or would you speak with leaders of clinical services to review the working conditions of the residents? So let's see, any thoughts or comments from anyone? Anything, Eric?
Yeah, so it looks like we have multiple choices being selected, meeting with the resident to discuss behaviors, investigating further, thinking about it as a systems issue, and then also looking at the working conditions within the clinical learning environment.
Yeah, so I think I meant to put it up as like, in some ways, it may seem kind of cut and dry. The residents yelling at the nurse out loud. That's really inappropriate and in some ways kind of unacceptable. But let's look at this in a broader perspective. And what are our responsibilities as teachers in this situation? And so just remember, as a faculty member, we have this actual, in some ways, dual set of responsibilities to both the patient and the learner. And this can come up in a number of different ways. Okay. Here's another case. During team rounds, a male patient makes ongoing comments about a female medical student's physical attractiveness and sometimes alludes to wanting to take her out on a date. These comments are not addressed by anyone on the team. So thinking about that, and there's just some discussion questions. What actions would you take? What would you say to the learner, to the rest of the team? What are the professional values as educators that are involved? And what are the systems level interventions that you might initiate to prevent similar events? And are there skills that you would like to develop for future incidents like this? I know for me, these kinds of situations, you feel like, is the patient demented, or like, are there these mitigating circumstances? What are the behaviors of the other members of the team towards the medical student? How does this all fit together? Is something that we want to think about. And that's something that's not easy to do. It really is hard to make a comment in the moment, and sometimes practicing in advance can be helpful. And I bring this up as a case that, we don't have opportunity here in the grand rounds, but this is the kind of thing you discuss with your colleagues and plan in advance. And this kind of case, by the way, is not uncommon. In this study of residents and fellows, patients were cited as the primary source of mistreatment in the learning environment, especially microaggressions and offensive remarks. So actually, even practicing in advance, this is like, I'm sorry that this is so tiny, but this is a chart from that study. And if I think I have the PDF, Gina, if you want to share it in the chat, if anyone wants to get a copy of these slides, they're welcome to it. And there's been work by people at the University of Minnesota in collaboration with us here at UCSF, with 12 tips on how to respond to microaggressions and overt discrimination. So this is not uncommon, and these are skills that you can actually learn. So let me move on and talk a little bit about my experience as in this Academy of Medical Educators Professionalism Action Group. So the Academy of Medical Educators is a group of educators here within UCSF spanning all the different schools and all the different departments. And each department has some members, which our department does, and I'll go over that in a little bit. And Ann Poncelet, who's the director of the Academy, charged myself, and I'll go through, and others, with a review of how can we promote professionalism within our Academy. And we did a series of workshops held in early 2020, right before the pandemic, actually. And we actually adopted a set of guidelines and developed some next steps, which I'll go through in a minute. So the charge. So this is Ann Poncelet, who is a great role model, and I completely admire. These are two other people who I want to question. No, I'm only kidding. These are, if you can recognize Eric and Rob here, great colleagues, really. So happy that they're in the picture too. And this is Jody Steinauer, my co-chair, who also is a role model for professionalism and organization and energy and how to get this thing together. But our charge for the action group was to review all these professional standards of educators and clinicians. And there are very few combined standards for people who are both teachers and who are clinicians. So our job was to review those standards, propose some educator professional guidelines and standards for the Academy, and then recommend ongoing promotion and training in these standards for the Academy, and then develop a support system to address mild to moderate professionalism lapses by members, and then recommend a process for severe lapses. So you can see we sorted them out, and we had this plan for having different levels of professional actions. And so I'm not going to go through this, but this is kind of what we found. And each, throughout the workshop, we kind of, the conclusions that were quickly drawn were kind of like, professionalism is not something you're born with. It's a set of competencies. Professional behaviors are embedded in systems. Feedback, we got feedback on these guidelines, and through an iterative process, we built up the guidelines to make them into the final form. We reviewed, and as part of that, we reviewed case examples with discussions on how would our guidelines apply to these cases. And then we discussed how to deal with the range of professionalism lapses. Okay. And then finally, I'm going to hammer this home again, like fostering professionalism really depends upon a culture and peers and advocating for systems change as well. Okay, so we did a series of 6 workshops at each of the main UCSF sites. This is Jody Steinhauer. Just to know that I guess it's just so you know, we didn't deem it unprofessional to eat donuts. That was the one kind of vice we allowed ourselves during these workshops. Now, we had other vices, but the donuts were the best ones. This is a copy of our professional guidelines, and we really tried to make it 1 page. That was the other thing. I'm a stickler for things that are brief and short, so 1 page I thought would be more professional. And then the other thing I want to note too, we had these series of kind of commitments or attestations that we had, but in parallel to these personal attestations, we actually had a systems attestation that was in parallel. So I know this is in small font. Let me just read a couple of these to you. But so one is, we commit personally to uphold high standards in all interactions with patients, colleagues, staff, and learners. And in parallel, we want to commit to advocate for the necessary resources and support, highlight systems issues that create the best possible learning environments, including adequate space and resources. So part of being a professional teacher is to actually make sure the learning environment is appropriate and adequate, okay? Similarly, I won't go through all these, but we had these similar kinds of parallel processes for the personal commitments to a systems advocate perspective. So thus far, we have had a final approval of these guidelines. We're gonna have an oath that we're all gonna say at the celebration of new members and attestation, ongoing professional workshops, case-based sessions, and we're working on a proposal for procedure for professionalism lapses. We have that largely in place. 2 other members of the academy here in this picture, Eric again, and then we are still, these are grappling with how do you advance the culture of professionalism throughout the or a organization. So that's a segue into the next piece. So now that I've talked about, professionalism as teachers, let me talk about professionalism as a continuum or a set of competencies. So again, thinking of, there's a range of unprofessional behaviors, and these are under the umbrella of harassment. You can get all these different kinds. I'm not going to go through them all in detail. And there's a severity continuum as well. We think of microaggressions in some ways like they're inadvertent, but things like bullying or hazing, that's purposeful, and those are on a severity continuum. Here's another case, a negligent faculty member. Here's another case of professionalism. Tell me what you think about this. A busy faculty member receives requests simultaneously for 9 resident MedHub evaluations. He has also agreed to write 3 letters of recommendation. They're all due in a week's time. He feels overwhelmed and rushes through the MedHub evaluations. He does complete all 3 letters of recommendation, but on one of them he feels guilty about not writing it more carefully. Is this an issue of professionalism? This is a picture of the faculty member, and I would propose that this is a kind of professionalism issue. And how does the faculty member develop the competencies? And it's not an easy thing. I think we all fall into this, but as you get more experience, you learn how to try to avoid these situations, and it takes practice actually to figure out to time it all correctly and make sure plan ahead a little bit. But that has to, in some ways, take practice or thinking about it in advance. Now, the dominant paradigm of professionalism is dichotomous. That means you're either professional or you're not. So you're either professional or you're unprofessional. And in general, we kind of assume everyone is professional until there's a lapse, until someone makes a mistake. Then we're like, aha, that person is unprofessional. And traditionally, the responsibility for managing this problem of professionalism lies within the educational system. So Eric, as a residency training director, or myself working with medical students at times, our job is supposed to be like, well, we're not supposed to let anyone by who's unprofessional. We're not supposed to let them progress. And if we let them progress and they're unprofessional, then it's the educational system's fault that we let through these unprofessional individuals. But I think it's a lot more complicated than that. I think you do get more professional as you get older. I really do feel, even in myself, that I've gotten, you go from novice, beginner, you kind of feel competent, professional, and you get good at it, expert. And so moral readiness, obviously, is a prerequisite. Judgment, skills, and I would say experience are really necessary, and experience is really helpful. Experience comes into play less is abetted by having role models and mentors who can help you along. And just to remember to think of professional as a developmental competency, and it follows a curve. Another example of professionalism requiring judgment and skill. And there are actually like specific competencies that you can develop for building your professionalism. Those are self-awareness and control, situational awareness, alternate strategy development, crisis communication. Communication skills are really helpful in professional. Managing boundaries. We, as those of us who are experienced in psychotherapy or the professional boundaries, understand this. Coaching and intervention, effective apologies. I would add effective feedback are part of professionalism. And I'll get into how we can improve our own professionalism through learning more skills around feedback. So that's just a little plug for professionalism as a continuum. It's not an on or off thing. And I think, as I've mentioned already, professionalism is a systems issue. So how do we think about professionalism as a system issue? So here's a case of a medical student. And again, Steve this is a case of lying. Steve is a final year medical student on a psychiatry inpatient rotation. His resident has a medical appointment early that afternoon and has left for the day. Earlier, the resident realized that he forgot to order a repeat chest x-ray on a patient who's being discharged to a residential facility. Routine x-rays can take up to 4 hours to be done at this facility. So the resident tells Steve, or texts him and says, order it stat so that the chest x-ray can get done right away. And then the resident leaves. Now, the attending overhears Steve order the chest x-ray. Steve tells radiology that the chest x-ray needs to be done immediately. The patient needs to be discharged. Radiology apparently disagrees and says they won't do stat chest x-ray without a clinical indication. Steve doesn't know what to do and tells them that the patient has coughed up blood so that the x-ray gets done right away. So the student has lied to the radiology. So what do you think? Should the student be failed from his clerkship because he lied? We don't have a polls, but if people want to put in the chat A, B, or C, that'd be cool. What do you think, Eric? How are we doing in terms of the?
Descartes, it looks like you're getting a lot of no's. The student shouldn't be failed, although a handful of yeses.
It'd be interesting to understand, what are the determinants for people who say yes or people who say no. I think the idea would be, the student is caught in a conflict here, right? He's been told to get this patient out on time, and the other thing is to be true to his word and not lie. That lying is not like something that we actually could condone as a professional value. Now, I just want to mention, in this series of workshops that we did, this case, as you might imagine, garnered a lot of discussion. And one of our senior faculty members said, we all lie probably on a daily basis in our professional roles. Like, how many times have you tried to get a prescription for someone, or when you write a diagnosis down and you don't necessarily think that they meet that diagnosis, but you do it for various other reasons, like insurance reimbursement and so forth. And that was kind of a sobering thought from the senior faculty member. And so when you think about professionalism lapses, I'd like you to think yourself about if you've observed something or complaint that you've dealt with or observed. Think about who were the involved parties and what was the context? What were the systems issues that were related to this? Were there mitigating circumstances? If there were observers, did they intervene or say anything? And what are the responsibilities of educators in this kind of situation? Catherine Lucy and others have noted that if you do a root cause analysis of professionalism lapses, there are often competing demands that placed on the person that cause these professionalism lapses. And these are often, can be categorized as either values conflicts, patient conflicts, Maslowian conflicts, or systems level conflicts. And that we have responsibilities in all these arenas, and they can conflict with each other. And the corollary to this is that these conflicts are inevitable, actually, and should be anticipated, right? If you agree or disagree with this, this is just some more food for thought. Many physicians struggle to remain professional. In this survey of physicians, physicians agreed with the standards of professional behavior promulgated by professional societies, but they were not always able to conform to those norms on self-report. So again, thinking about a systems view of professionalism. I'm going through that. And again, this is in small font, so I apologize, but like an example of a Maslow conflict that a physician might have is, should I sign up for more shifts, i.e. moonlighting, to support my family, which helps my values of safety and belonging? Or should I study longer to learn more, which is kind of the pursuit of excellence? A values conflict would be, should I leave at 12 noon after being up all night, thus avoiding fatigue-related errors? Or should I stay and continue to care for my patient at a critical juncture in his case? I think as a psychiatrist, maybe it's like, I had a bad night last night, I didn't sleep well, I'm mildly ill. Should I continue with my sessions for the rest of the day for the patients who kind of need me, but maybe it's not good for me? Interpatient conflict, and this happens all the time, I think. Should I demonstrate compassion by spending extra time with this patient who just received bad news? Or should I just demonstrate respect for the next patient by trying to stay on schedule? And systems conflict. Do I refer my patient to someone on the insurer's covered list, or do I send her to the provider I believe is superior? So I think these are just examples of conflicts and challenges that I don't know if we often think about them as professionalism kinds of issues, but I think it's really worth it to think of them as such. And there are pain points that we can all predict that often are a result of systems conflicts. So no matter how good or experienced or inexperienced the clinician is, they're going to experience a conflict in professionalism in these certain situations, and we all know them, and we can talk about them, and we should. I don't think we do enough, I think is the point. So let me just wind up here with kind of some thoughts about next steps. There are a lot of little skills that one can learn, it turns out. I myself am just starting to kind of scratch the surface of this or begin to learn some of these skills. One of the simplest ones, and this is for, like, again, this is not for egregious professionalism, but if you see someone who does something mildly unprofessional or, on a continuum, and you can see as a kind of, promoting professionalism by sharing a cup of coffee. And this has been written about and actually in some ways codified. And these are like brief conversations that you can have with someone. It takes 2 to 3 minutes. I could go into, I'm not going to go into great detail. There's a couple of brief articles written about it here, and just how you can develop this, not have this big iceberg of tolerance underneath the thing that gets really big in the end. This is a roadmap for tending to a range of professionalism lapses. So one of the things to think about is when you're dealing with professionalism lapses, range. So it's very rarely, it's not either professional or unprofessional, or the person's fine or terrible, or acceptable or unacceptable. But thinking about, so for milder lapses, you might think about exploring and try to understanding the lapse. So if you're the faculty, your role is more as the concerned teacher, exploring the lapse, giving feedback, explaining, exploring the student perspective, and the goal is more about mutual understanding. Remediate is about, for more moderate, I guess, professionalism lapses. So as a faculty member, you might think of more like, okay, this person needs some work. You're going to be a supportive coach. You're going to provide feedback. You're going to improve their skills, because professionalism can be improved. You're going to create reflectiveness in the learner, help them self-reflect. You give them feedback. You coach them for change. And your goal in this situation, you might need to be clear about the consequences of not reaching the goals and setting the timeline for improvement. So this is for more moderate professionalism. And then for severe professionalism, and maybe if you've tried multiple of these other situations for minor ones, you as a faculty member, as a teacher, are the gatekeeper for the profession. So this is someone who you may feel may not be able to proceed forward as a member of our profession. And the context for this is there are persistent problems, patient safety is at risk, the person has very minimum impaired reflectiveness about this problem and doesn't seem to be on the road to improving it. And so in this situation, the goal is to gather evidence for committee review and maybe even dismissal. So this is the more severe one, which we don't want to get to. We want to do these first, hopefully. And then finally, one we added in our workshops was when you deal with these medical student professionals that lapses, don't forget to step back and take a systems level view of what are the contributing factors. So in our what are the internal and external environments, and to advocate for improvement. So in our discussion of, say, the resident who was on call who yelled at the nurse, what was the sign-out system? What kind of sign-out system do you give about the patient who's in chronic pain if they continue to complain? There wasn't a contingency involved in that. The workload of the resident in the emergency room may have been too much. Doing something at 2 a.m. when you're really exhausted, responding professionally is really a challenge for most people, I would say. So thinking about all these factors and how we can mitigate them. Was the resident, had the resident been on call or been moonlighting earlier to make them especially fatigued? So to step back and try to take in the bigger picture. Team leaders can increase the likelihood of success by doing some simple things like planning for common slips. So starting rotations with requests for corrections in the moment from your learners and setting the culture. Recognizing high-risk patients in situations. So we all have those patients that we kind of cringe as we think about working with them. So how to share that and teach trainees. And prepare people that you may have these cup of coffee moments with them, or coaching in the moment conversations. So saying things at the beginning, like if I think or hear that the tone is off or I feel uncomfortable, I'll try my best to have a conversation with you. And so not to take it personally, or this is just part of what we do here. And again, this is kind of increasing the likelihood of success is kind of setting the culture. So just getting back to this old, the bias of professionalism upholding old traditional standards, I challenge us to think about adapting professionalism as a dynamic thing that changes over time. So I'd like each of us, these discussion questions, what's your personal relationship with standards of professionalism? I was struggling with Gina before coming on today, whether I should wear a tie for this. This is the first time I wore a tie in a year and a half now. And again, this is a surrogate for professionalism. Just want to mention that. Have you seen these standards? How have you seen these standards of professionals play out in your workplace? How have you contributed? So I'll just take a very mundane and maybe banal example. It's just wearing a tie. Like it used to be, everyone had to wear, all men had to wear a tie, but nowadays, and I agree with this. It doesn't signify anything if you wear a tie or not, really. What are some ways have you seen others challenge professional standards? And who might be an ally in changing your workplace culture? So whether you wear a tie or not, I think is relatively trivial, but there are other things that might be bigger ones that you want to think about and address. There are tons of resources there about faculty development. And here's a online resource, faculty development. It's free, a series of 6 online modules that you can help, helping you practice these competencies that I've been talking about. And they have defined them as ethical decision-making, feedback management, how to deal with harassment, e-professionalism, conflict resolution, and sexual violence. So this is as of at least a week ago, these were all open and free to outside faculty. So, and I know, by the way, Eric is an expert in a lot of these, and he's done modules for residents and medical students on a lot of these topics. So just a shout out there. This is Catherine Lucy's book, Understanding Medical Professionalism. It's an excellent book with tons of case examples, so you can really think about things. It's also, for those of you who are on faculty, you can go, it's available online as a kind of an ebook, but it's like online, so each chapter is a separate little link through Access Medicine. Renee has been a big big role model for me in general, but also just a resource for professionalism. There's a lot of stuff about how to report mistreatment here at UCSF. I just put the easiest ones down. So if there's mistreatment of residents or medical students, they can click on this link. For faculty, this clicks into a link with more complex explanation of how to proceed. So you're not committing yourself by clicking any of these links. Now, one thing that I've been grappling with as the next level problem is how do we incentivize professionalism? How do we get people to be the best they can be? And there's this problem of alignment. So when systems we attempt to teach will not, in the end, do what we want or what we expect, ethical and potential existential risks emerge. And I was, this is a very tangential topic, but Ezra Klein has a podcast where he was interviewing this guy named Brian Christian about his book, Machine Learning and Human Values, and the challenge of AI coming. How do we incentivize AI to do what we want it to do? And I was listening to this podcast, like, forget about AI. How do we incentivize people to do what we want them to do? This is the challenge that we've had ongoing for since humans have lived in societies, I suppose. And so I just bring this up as hoping that you can think about, there are times when maybe we inadvertently incentivize the wrong thing, and how we can, and if you see that, that's part of professionalism, and how we can incentivize professional. Now, if we paid everyone $1 million to be the most professional person, that wouldn't in some ways be professional, right? Because through our faculty or power of empathy, we can go into that person's mind and say, well, that person's just doing it for the money. That's not really professionalism. If the person does it for like being the best teacher they can be, or being the best doctor they can be, or the best scholar, then we can say, okay, that's professionalism. I realize that changing the culture means changing worldviews and habits. Again, this is not something that we in the Department of Psychiatry have a unique issue with. We have to, start with ourselves, obviously, but thinking about this as a problem that occurs, or an issue that occurs over time. Another thing, I thought that we do have an advantage and a unique perspective as psychiatrists. And for those of you who are familiar with the Perspectives of Psychiatry by McHugh and Slavny, they talk about a behavioral perspective and how do you help people with behavioral problems. And you could consider them not as a pathological thing, but could be a helpful thing. But what are the stages that typical treatment stages that you use in a behavioral perspective to change behavior? Engage the person, you address immediate problems, you strengthen the commitment to change. There's this thing about pharmacological treatment in the book, which we can't do for probably abstaining from pharmacological treatment is a professional act. Ongoing relapse prevention and anticipating relapses, kind of what I say, anticipating conflicts. Organized a behavioral system of reinforcements. How do we incentivize professionalism? And in some ways, we may have to restructure our life patterns in thinking about this. So how do we get everyone in this culture of change and pushing forward to, having a positive view of professionalism? And the other example we know in psychiatry is the example of AA, and they have this down. I mean, the AA really is about improving this culture of behavioral change, and in the end, people find their lives change, and you have to restructure your life patterns. So I just bring this up as we may have a leg up as a Department of Psychiatry because we're familiar with these systems and models of perspectives of change. So one final thing I wanted to say is we're supposed to champion positive examples of professionalism. And I've shown a couple of pictures of people. I just want to champion, just mention a couple more. This is Lowell Tong, who's been my mentor since I was a resident. I don't know if he's on today, but I just want to big a huge shout out to Lowell as an amazing role model for professionalism. And for those of you who know Lowell, he has like this great ability to formulate policies and understand the details of rules and protocols, but underneath that really lies a really humanistic perspective and really wanting these rules and understanding that these rules have to work for people. So I just wanted to emphasize that's been a really wonderful role model for me. I got this picture off the internet. This is a less formal picture of Lowell. And yes, in a dramatic demonstration of professionalism, he decided to wear a cap and gown to work. No, only kidding. This was at a graduation, but of the School of Medicine. But that's Lowell, also looking professional. Also, a couple champions, some other people here in our department, and there's going to be people I miss. I really apologize for that, but just a couple of people I know personally really well. This person right here is Ray Zablotny and Peter Foster. They're volunteer faculty who work in the bipolar clinic with me week in, week out, and fabulous teachers, and they're volunteers. They do it. If you were in their shoes, you're like, these guys are amazing. And so I just wanted to highlight them. You probably know all these people down here, or many of you know some of them. I don't necessarily recommend wearing your old Columbia sweatshirt to a gathering of a more formal gathering of your friends, but I did it anyways. Back to the Academy of Medical Educators, these are the members, and so I want to thank them all for being role models of professionalism and as teachers, and I want you, other people who are on this grand rounds, to feel free to, I'll volunteer them all now to be resources for you for professionalism, and just thank them all for being my colleagues: Amin, Rob, David, Eric, Q, Alyssa, Damien, Andrea, and Lowell. I don't know how Alyssa got her one color photo. The rest of us are black and white. That's something that you can ask her later. Yes, Eric's kind of mentioned that in the chat as well. Some other people who are just around who are great role models and inspirations to me, and also up and comers who are also still like inspirational to me already. So thank you, teachers. And then finally, as you've been thinking about this, any ideas about how to do experiments and be scholarly in our thinking about professionalism? I think this is an opportunity for us to really begin to do some experiments, or kind of be creative about how we want to. I mean, having a movie night is my way, is my very limited way of being professional, and kind of getting our community of educators together. But if you have other ideas and stuff, please reach out and contact me. So that's it. Let me just summarize what I've gone through, and maybe we have a couple of questions at the end here. I think I'm just about on time here. So the problem of professionalism, it's like we see these terrible examples in the press and newspapers, and underneath them are actually even a bigger problem of the culture of professionalism. We also have the problem of, it's a complicated problem. It's not a simple technical problem that we can just solve with one simple intervention. So if we go from professional as being this one word thing, as a very simple thing, and think about it as a complex problem, we can begin to tackle it in a much more appropriate, I think, kind of way. We talked about professionalism as a teacher, where we have this most obvious conflict between care and teaching. And so thinking about that as a conflict that's going to be implicit in our roles as teachers and faculty members in the Department of Psychiatry, Behavioral Sciences, and planning for that and thinking ahead. And I think some of that dealing with microaggressions is an example of how we plan in advance for that. Thinking about professionalism as a continuum, as an area of expertise, you can get better. There are all these little skills and competencies that you can learn. Thinking of professionalism as a systems issue, that systems can set up individuals to be more or less professional. And so whenever we are dealing with professional, we have to think about the context in which professionalism is occurring, whether positive or negative, okay? And then finally, I just wanted a little bit of a call of next steps that we want to think about our culture and our peers as our main resources for professionalism. It's not something we can even define professionalism that easily, as I mentioned. So the role of peers is so important. And also thinking about our next steps in terms of scholarly activity and any experiments that people want to do. Please feel free to reach out to myself or any of these other volunteers that we have in this grand rounds. And the PDFs of these slides are in the chat, and that's really it. So I think I'll stop here and take any questions or discussion.
Wonderful. Well, I think we have about 11 minutes for questions and discussion. So let's start. And just to remind everyone, if you would like to put your question into the chat, please feel free to do that. And we will sort of raise questions from the chat as we go. Descartes, I just want to say such a fantastic presentation and very thought-provoking in a lot of ways as we think about professionalism on a continuum and also as a systems issue. If I could take the moderator's first question, how do we think about the multi-generational workplace? And as we think about how each of us emphasize or de-emphasize certain aspects of feedback, communication, going to the top, different values that different generations may hold, how does professionalism conversations take place in a multi-generational workplace?
I think we have to just know each other as best we can. So that's why peers are so important. And as I mentioned, professionalism is this dynamic and changing concept over time. And so what things meant years ago mean different things now. So we have to be open to that and understand. So we're not kind of isolated completely in our own culture of professionalism, but that the different generations bring their own perspective to that, and they all have validity, and we should respect them all, but we need to kind of understand them to get to that point. So part of our role of professionalism is actually, I think, learning and understanding how other, I'm reluctant to use the word generations because that seems like we're so separate. We're not that separate, but other generations think about things. So I think of a kind of a simple example about like people who had lots of tattoos. When I was growing up, like you didn't wear tattoos unless you were, someone who was in jail or something like that. Now my own children have plenty of tattoos, so I, have to have had to change my views on that. Again, that's a kind of a mundane example. And I know you're really interested in this topic too, Eric. So I'd be interested in hearing your perspective and anyone else's. One other thing before I hear Eric's perspective on different generational differences in professionalism. I wonder if people wanted to raise their hands if they wanted to make a comment. That'd be okay with me too, if you want to do that. But Eric, what are your thoughts about this generations in professionalism?
I really appreciate the kind of just the emphasis on just trying to listen and hear the other. I think so often we jump into making assumptions, right, about what is, and often in a binary way, what is professional versus unprofessional, and trying to understand, the other person's perspective is such an important first step that we sometimes bypass. And so I appreciate that you mentioned that as well. I'm going to share a couple of questions. We've got some great questions in the chat. We're going to start off with a question, Descartes, around playfulness, which is a really fun one. So in your view, how does professionalism, or in your view, does professionalism explicitly include forms of play? Play in teaching, among peers, and also in patient interactions? And assuming that there's no impasse of competing priorities, it seems that a life of clinical practice requires a kind of continual play. Individually construed perhaps, but to be a play nonetheless to be sustainable. So how should our educators model this? And if so, is a lack of playfulness a more banal unprofessionalism?
I love this question. And I think as I've been working on this topic, I think, we have this view of professionalism as this kind of negative thing. Basically, we're all just struggling to avoid unprofessionalism, right? But I think as we aspire to the highest levels of professionalism, I think play has to be in there. So if you think about like the people who you admire and who are able to be good role models for professionalism, actually people who are enjoying their work, who are able to be creative, that should be something that we could aspire to as part of professionalism. Expertise and excellence in your work is part of professionalism too. And striving for that is part of professionalism also. Now, you can see that professionalism can get really broad in these kinds of things. So it may be a little bit arbitrary where we draw the lines between what is just the pursuit of excellence and what is the pursuit of professionalism. But I do want to help us frame professionalism as it's okay to be above average, and we should try to champion and think of people and give positive reinforcement to, for those of you who are of the mental health, psychological bent, positive reinforcement for people who go above and are above average. We don't do that enough, I think. We don't reinforce behaviors that we think are really good. So I love this example of professional playfulness and creativity as examples of areas we could get better. And there's overlap between wellness and advocating for wellness might be another example of professionalism in its highest form. So.
Thanks. This is a question from Jake. Jake, who says, very interesting talk. I wonder if you might be able to further touch on how professionalism has been used to enforce racial and gender hierarchies within the house of healthcare and undercut the advancement of labor rights for trainees and healthcare professionals overall. So as an example, I was struck by the fact that both the Maslow and values conflicts could just as easily be described as issues of structural inequity. Yet by couching them as personal conflicts, it locates the quote unquote problem at the level of the individual practitioner.
That is an excellent critique. I thank you, Jake, for making that comment. I don't know if I have any, I can only say that's an excellent comment. And I think what we have to do is make sure that's why professionalism has to be a dynamic, living concept. It can't just be static and be one place. I think Jake is bringing up this like really important issue of like, how do we keep it alive and how do we make it so that it isn't used as kind of the enforcer of status quo. So, but still on the other hand, be a positive force, you know. So I think Jake's comment incorporates all of those. So thanks, Jake.
Wonderful. Our next question is one around our clinical learning environments, which include many healthcare professionals, sometimes perhaps with different shared models of what professionalism means to that particular profession. And so how do you think about particular challenges when different disciplines and professions with different kinds of models of professionalism interact in the clinical and teaching settings?
Oh, that's a good question. So how do we respect, you know, am I interpreting this correctly, Eric, that maybe this is like an interprofessional kind of a question? How do we respect differences in professional values sometimes?
That's right.
And at the same time work together. And then sometimes, you know, these are not necessarily, it's kind of like having a competition is not necessarily a bad thing. Like someone has to, but I guess you don't want to take it to the extreme, but someone has to hold I guess it's best if each individual holds like several poles, but sometimes, you know, one person holds the pole of education, another person holds the pole of patient care, third person holds the pole of research, and that's okay, but understanding and respecting each person's perspective is really important. So I avoided the any interprofessional examples, but there are plenty. I want, as you mentioned this, I want to put a plug in for, there are workshops that are being done, and I just did one actually not long ago with Anne Poncelet about a workshop in professionalism in the academic workplace. And so our own Center for Faculty Educators is running these workshops on professionalism. I don't have one. I should have, now that I think about it, should have put down the next one that's coming up. But for those of you who are interested, there are workshops where you can meet with colleagues and discuss some of these cases. I know professionalism can sound kind of dry, but these are really interesting discussions.
Another question, which is kind of stemming from a comment, which is just the word professionalism, you know, is so highly charged. And I wonder, and I think that the comments kind of reflect this in the chat, you know, I wonder if the language itself impedes our ability to have a continuum-based conversation around professionalism, because professionalism in our minds is so sort of dichotomous and binary. Do you have any suggestions about just the wording itself in the language to promote the kinds of professionalism conversations you're suggesting to have?
Yeah, I don't, you know, I'm not particularly wedded to the term professionalism, you know, but it does capture some of the things that I think, for example, that well-being would not capture, for example, or fairness even is a good term that I love, but it doesn't, professionalism doesn't capture that. So I think thinking of professional in this broader view and just co-opting this older word, but if there's another better word out there, I'm totally interested in doing it, but using it. And I think even though we often don't think of it this way, but like professionalism can be not just the individual, but a system. You could, like, some systems are just very prone to unprofessional behaviors. Like, it's like if you are in that system, you're just going to be unprofessional. And so, you know, a lot of times as good clinicians, we try to avoid those kinds of systems. But on the other hand, you can call in the question of, like, you go into a system that's conflict laden, but maybe it is a good thing to go into that system and try to make changes yourself and try to make it less unprofessional or prone to unprofessional behaviors. In some way, you know, you could view that as a professional endeavor by the individual to change an unprofessional system.
Great. Do we have time for one more question, or do you think that we're about time? Well, maybe I'll put this out there just as kind of food for thought for all of us. And so, you know, as we think about this kind of conversation of professionalism, you know, we all live in systems that have a fair amount of inequity, and, at the end of the day, we're, trying to just do what it takes to get through in some ways. And that means cutting corners, and perhaps it means, miscoding or other interventions to try to do the right thing for the patient. And I guess food for thought for all of us, which is just how do we think about this on the professionalism continuum? I think there were some questions in the chat that came up about that, and I think obviously this talk today, Descartes, stimulated a lot of that. So thank you so much for sharing, this model, this perspective, and for stimulating us this morning.
Thanks so much, Eric. And if anyone had any feedback, I think Gina's going to send out some stuff. So thanks so much, Eric, for doing this conversation. Thank you, Gina, for helping out with the grand rounds.
Everyone, have a wonderful rest of your day and beginning of your morning.